Hi, I'm Dr. Chris Hughes. So the first thing that everybody wants to really know about is, well, what really is a dental implant? So that's what we're going to talk about right now, about what is a dental implant. So this is a great model to look at. So here we have some teeth and we have a cutaway of what a dental implant is. So what most people don't know is a dental implant is really the replacement for the root of a tooth. So let's look actually at a natural tooth before we look at the dental implant here. A natural tooth is rooted in the bone. This part of the model here is the bone. This part is the gum that lays on top of the bone, sort of like how carpet lays over a floor. And a natural tooth is rooted into the bone. And then of course this part here is the part that we chew on that we call the crown of the tooth. So the best way to understand what a dental implant really is that it's simply the replacement for the root of a tooth. So you can see that this little metal cylinder here is actually the dental implant. Most people think that the implant is the whole tooth, but it actually really isn't. It's just the replacement root, which is this metal cylinder. Most implants are a cylinder or a screw type of object, okay? And they go into the bone. After the dental implant goes into the bone, then what's put in is called an abutment. Some people call it a post, because we need something for the crown which goes on the abutment to hold on to. So this is the crown that's made afterwards, and it goes onto the post like that. The dental implant really is a series of things that are used. Number one, it's just the replacement root, and then the abutment, and then the crown. That's what a dental implant actually is, okay? Now, one thing that we may want to think about is, what's an advantage of a dental implant in replacing a single tooth? Back in the bad old days, years ago, before dental implants came along, we didn't have a lot of good options for replacing teeth. What we would typically do is we would make a bridge. So for example, if a tooth were missing here, what we would do is we would reduce and reshape this tooth, and it looks like basically a stump, and we would reduce and reshape this tooth over here, and then what we would make is what's called a bridge, which are basically two crowns here and here with a false tooth that's fused in between. And so that would fit on like this, okay? Obviously, the problem with the bridge is that it's a three-tooth solution to a one-tooth problem. We're having to use two basically healthy teeth and reduce those down like this in order to replace the missing tooth. Not such a great idea now that we have dental implants, but back 30 years ago, or 40 years ago, this was what was very commonly done and had been commonly done for the past 100 years. Now we can do the replacement of one tooth with one implant. So for example, instead of having to reduce these teeth, what we do now is we put in a substitute root, which is the dental implant, and then we put in a support tooth, or the tooth that goes on the implant, and the abutment. And that is a one-tooth solution to a one-tooth problem. We're going to talk more about if we're missing multiple teeth and how dental implants can be used in those situations. But this is the basics, Dental Implant 101, and this will help you understand what fundamentally a dental implant is. Thank you for joining us.